You are listening to the Evolve Your Intimacy podcast with Dr. Stepahine, where it is my goal to educate, enlighten, and evolve your intimacy. You can find me at evolveyourintimacy.com to learn more about counseling, self-study courses, sex, and the retreats that we have to offer. This show contains discussions about relationships, intimacy, and sex, and is meant for those who are 18 years and older. Now, sit back, relax, listen up, and get ready to evolve your intimacy.
Thank you guys for joining us today on Evolve Your Intimacy with Dr. Stepahine. I am Dr. Stepahine, and I am thrilled to have Eve joining us today. Eve is an exceptional licensed physical therapist with a specialization in pelvic floor therapy and sexual health. She's here today to guide us through enhancing your sexual well-being. Her extensive experience as a certified health coach, coupled with her experience as a seasoned physical therapist, she stands at the forefront of addressing some really complex sexual health concerns, and her holistic approach to treatment has brought relief and empowerment to numerous of individuals facing difficulties, including those grappling with some decreased vaginal sensitivity and dryness. And that's what we're talking about today. Eve, thank you for joining us.
Of course, we're going to be talking about one of my favorite subjects, so I'm excited to be here today. Thanks for inviting me.
Yes, I am so excited. So those of you listening, if you're watching on YouTube or if you're listening on the podcast, Eve is an educator, just like I am, for SDC. And that's how I found Eve. I was combing through on my SDC profile, and I was like, oh my goodness, I need to talk to this woman. And so I reached out, and she immediately said yes, and I'm so very thankful for that. And so just really quickly, can you start by telling us about your professional background and your expertise in this women's health?
Of course. So I am, like you mentioned, a licensed physical therapist. I have a practice. It's called Inspire Health Physical Therapy and Wellness. And I have been treating pelvic floor issues for maybe 6 or 7 years now. And I just love treating this area of physical therapy because sexuality is something that brings us joy and happiness. And when you are not able to experience that in your life because of dysfunction, it can really be a traumatic experience and can affect people's mental health and so many other things. So that is what I do. And I love talking about sex. And so I actually started a podcast about a year ago called Please Me. And you can see some of the pictures behind me of some of the people that I've interviewed. And it aims to destigmatize conversations about sex and sexual health. And, I find that that's such an important topic of conversation because a lot of times I'll have clients coming to me, and you may be experiencing this too with your clients, that they'll often say that they don't tell their loved one, their partner, their wife, their husband, that they're coming to see a practitioner to help them with the condition. So, that is one of the reasons why I love talking about sex and sexuality.
Well, that leads me to my next question is, how common is decreased vaginal sensitivity and dryness among women? And then also, do you feel that topic receives enough attention?
No, I really don't. I have to say that the equivalent condition in a man is erectile dysfunction. And that seems to receive lots and lots of attention, lots and lots of research. There's medications that address it, etc. And for women, it really is not a topic that a lot of us talk about or even hear about. So I think it's so important that you are keying in specifically on this issue because it is so very common for many women. And most of the time, it's because of hormonal changes and blood flow changes. And that happens to all women over time as we get older. So it's so important to be talking about this.
I 100% agree. And it's definitely something that a lot of women, a lot of issues. I mean, I a therapist, I talk to women and men on all different levels about all different things, but I specialize in sex, of course. And I didn't realize that a gynecologist only has 4 hours of sex education. That's it. So when we're going to our gynecologist and we're like, hey, so this is going on down there, they're like, okay, here's some pills or here's a suppository, but they really don't know the extent as like we do, so to speak. And I found that out from my own gynecologist because when I was in there getting my yearly exam a couple years ago, she was asking me what I did. And I told her, and she was like, girl, give me business cards. She goes, I've got so many to send you because we only get 4 hours. And, sexual health is not something we're well versed in. And I was floored when she told me that. So, and I don't.
So true.
Yeah, people don't understand that sexual health is not something that a gynecologist studies.
No, and it's interesting that you say that because I'm hearing a lot of what people are hearing from their gynecologist regarding hormones. And, if you're in post-menopause and you go to your gynecologist, a lot of them are going to tell you, you don't need to get your hormones checked because you're beyond menopause. And so your hormones don't matter anymore. And of course they matter. I mean, hormones help us to feel better, right? To feel normal, to have lubrication, etc. And so it's so key to really know what your hormone levels are. And the doctors don't even want to test you because they don't know what to do with the information because, like you said, they don't have training. And so, yes, there are, it's normal when you're in postmenopause to have decreased hormones. That's normal, but that doesn't mean that it's optimal. And what we want is optimal health, not just regular old normal health, because of course things decrease as you get older. But if we can get those numbers into optimal levels, why wouldn't we want to?
Absolutely. Absolutely. In your experience, and I know hormones, but in your experience, we were just talking about what's the most what's the most common underlying issues of vaginal dryness and decreased sensitivity, besides us being seasoned ladies?
And it really does not depend on age. Of course, as you get older, the blood flow to the area does decrease over time, and it really depends too on nutrition and diet. But many women that are in their 20s and 30s, if they've experienced cancer and have gone through cancer treatments, will go into early menopause. So this is not just an old woman problem, right?
Not at all.
This is really something that can affect people at all ages. And, just like men can get erectile dysfunction because of blockages in their blood vessels that go to the penis and genitalia, so too can women have decreased blood flow because of nutritional issues that can cause blockages in our blood vessels. And that happens gradually over time. So a lot of times, they'll say these conditions can be a precursor to heart disease. So if you are experiencing these things, it's always good to check with your doctor and make sure that your heart is healthy.
Wow. So tell me a little bit more about that.
Absolutely.
That's powerful. And I think that is absolutely not discussed enough. So tell us more about that.
No, absolutely. So I'm sure you've heard of atherosclerosis, which is a hardening of the arteries and also blockages in the arteries, right? And plaque will build up in your arteries. And when plaque builds up so much that you can no longer have blood flowing through that artery, you get decreased blood flow. And that's when, Viagra and Cialis stop working entirely. A lot of times when men will start taking that, it will work for them for a while, but then it will stop. It's because the blockages are so blocked that nowhere blood flow is going through. And the same condition happens in women as well. And the way that a woman's body becomes lubricated is because the blood flows to the vagina when the vagina and the clitoris and the vulva are getting engorged. Just like a man's penis has to get hard, a woman's vagina and clitoris also has to get engorged, okay? And blood has to flow to that area. And when it does, the plasma from the blood seeps through the walls of the vaginal canal and the vulva and the clitoris and moisturizes and lubricates the whole area. And so if you don't have blood flow, you're not going to have the plasma present in order to lubricate the area. So that is what causes decreased vaginal dryness. And also, if you don't have enough blood flowing, your tissue is going to become desensitized. So blood flow is very important for sensitization as well. And if you don't have all of that, you're going to have the decreased sensation and decreased lubrication.
Absolutely. And talk to us about how, if we have decreased vaginal sensitivity and dryness, how does that impact the quality of a woman's life and intimate relationships overall?
Well, one thing is the dryness, right? And then another thing can be if your hormones are also down. And hormones, I'm just going to go into hormones just a little bit here. But for women, we need estrogen and progesterone. Those are like the two really key hormones for our vaginal health. And if you don't have enough, let's say estrogen is sort of like a link in the fence of your skin, right? There are receptors on your skin from all along the lining of the vagina, at the bottom of your bladder, and then the tube that goes from the bladder out of the body, right? There are estrogen receptors all throughout there. And so if you don't have enough estrogen, it's like the links of the chain are missing. And so your tissue becomes very thin and becomes very papery and becomes very delicate and easy to tear. And oftentimes there will be micro tears that you don't even see. So if you have, a vagina full and a vulva full of little tiny tears, it's going to be extremely painful to have sex. And so it impacts our lives in huge ways. If you don't have lubrication, you're not going to enjoy sex, of course, like you normally would.
Let's just remind everyone that this is Evolve Your Intimacy, and I am Dr. Stephanie from Evolve Your Intimacy. We are having an amazing discussion, but we need to take a quick break, so stay right there and we'll be right back. Do you want to be on a ship with over 6,000 wild and naked friends? Drop an anchor in exotic countries? Explore all the sexiness the world has to offer? Come join me, Dr. Stephanie, on the next Bliss Cruise and allow me to personally guide you to better sex in my play shops, workshops, and private couples sessions. I invite you to come and let your wild and sexy desires become a reality on the next Bliss Cruise. To learn where we are sailing next, visit evolveyourintimacy.com/cruises. I can't wait to see you there. You are listening to the Evolve Your Intimacy podcast with Dr. Stephanie, and I am Dr. Stephanie. Now, let's get back to the show.
Now, there's so much information about erectile dysfunction and none about what we go through. And so I feel like these conversations are so very important to have, because who else are we going to talk to it about? If you talk to your best friend about it, they don't know because they've not been educated on this as well. So going through that, what approach do you recommend for diagnosing these? I know, and I just want to start off, when I have a lady or anybody come to me and they're like, I have decreased libido, yada, yada, yada. The very first thing I do is I say, we're going to go get your hormones checked. Because number one, I am really good at my job, but I cannot compete against nature, and hormones are something that I can't compete against. So if your hormones are out of whack, guys, we can try all the tips and tricks in the world and it might help momentarily, but it's not going to help in the long term. We have to get that leveled to whatever your levels are, and every body is different. So talk to your primary care physician or whoever you're talking to about that, hormone specialist, before. Don't take my word for it, because I'm not a hormone specialist. And then we'll come back and we'll figure out different ways to handle that. So what are some of the current treatment options available for women experiencing these issues?
So I love that you mentioned that you would get the hormones tested first, and that is absolutely true. What I will point out here is that the testing that they do in the gynecologist's office is usually blood tests. And if you are taking a topical hormone, as I do, because that's what I've found to help me, and we can go into that later. But if you are taking a topical hormone, because it is topical and you're using it at the site that you need it, your body sort of absorbs it into that area, uses it, and it never enters the bloodstream. So you're not going to really know if that is the, optimal level if you're doing a blood test, because it may not be accurate. So I recommend another testing that's a saliva testing. And it's actually just been created from a product that I recommend called Parlor Gains. And I'm really interested in seeing the comparison between the saliva testing and the blood testing. And I actually just recently got my saliva tested so that I could do a comparison and contrast. And I haven't finished doing that yet. I'm sort of in the process, but it's something that you should really consider. especially if you are using topical hormones, because you want to know what your levels are. And if you're doing the traditional blood testing that they do in the gynecologist's office, it's not going to be accurate.
Thank
So
you.
some of the treatments, yeah. And so some of the treatments you asked would be, I do a treatment in my practice. It's called acoustic wave therapy. And acoustic wave therapy, yes, it's amazing. There's another name for it called Gaines wave. And Gaines wave is like, like the name brand of like one machine, but it's basically the same exact treatment. It's called acoustic wave therapy. And what it does is it breaks up the blockages in the tissue in order to get that plaque to kind of slow away and to open up those capillaries and open up those blood vessels in order to allow blood flow. And then over time, over several different treatments, it also creates more capillary formation. And capillaries are the teeny tiny blood vessels that go to all of the cells in your body. So you want those blood vessels to continue to create more of so that you can get even more blood flow. And then with more blood flow, you'll have more lubrication and you'll have more sensitivity.
So that's exactly, I couldn't wait for you to bring that up. Now, I come into your office and we talk and you decide that I need acoustic wave therapy. Talk to me about what that process looks like.
Of course. So if you've ever had an ultrasound is typically on a wand, right? And so it's very similar in that it's a wand and you would lay down on my table, okay? And you would take off, clothes from your waist down. And I would talk you through the process. It's a kind of a loud machine, so I usually mention that because its acoustic wave is also known as shock waves. So it's little tiny shock waves that are being shocked into the tissues to break up those blockages. And so it's a little bit loud, but, I usually talk you through the process. And sometimes it can be, a little bit sensitive. So we talk about that, whether or not we want to sort of numb the area or if we want to just do it without the numbing. I particularly don't like to numb because I like to feel what I'm feeling. But, everybody is different. So we discuss that. And then the treatment doesn't last very long. It's maybe 10 minutes long. And I focus on all of the area that is, your, not just your genitals, but also all of the area around it, the mons, your inner thigh, because that's where all of those blood vessels are feeding into your genitals. So we want to break up all of those blood vessels.
How does it feel when you're getting it done?
It feels like little tiny flicks. So if you, flick your finger like this on your hand, it feels like little tiny flicks. That's what it feels like.
So is there any pain associated with it at all?
It really depends on the person. Some people are extremely sensitive and we do use a numbing agent, and some people tolerate it without. And most of the time it's tolerated without.
And so about how many sessions should you, I know everybody, again, I know everybody is different, but generically about how many sessions before you start seeing some results?
Yeah, so I recommend 6 visits just for prevention. Okay. So because, as we are aging, right, and getting older, our body is creating blockages that we may not even know are there yet. We may start to experience smaller issues like, say, for men, they stop getting morning wood. And for women, we start to have like needing a little bit more lube than we used to. Things like that you don't even really pay attention to, but are happening over time. So I recommend 6 visits for prevention. If you have a mild issue, I would recommend 10 visits, moderate 14, and severe 18. And it can be more or less depending on the person and their reaction to treatment. But those are sort of my parameters as to where I start with my protocol.
Okay. And is this for men and women?
Yes, it's the same exact treatment for erectile dysfunction. So it's just the head of the machine is changed to a different shape in order to accommodate the body part. So yes, it's the same exact treatment. So like I said, it's the female equivalent of the male erectile dysfunction.
I love that. I love that. And so we know about the treatments, about how long. We know that you said it takes about 5 to 10 minutes.
Yeah, well, the evaluation itself takes about 45 minutes to an hour because I really look at the whole person. We talk about lots of different things. We cover nutrition, we cover habits, we cover self-care. I talk to them about things that they can do to really increase that blood flow with different products that I recommend. And I do a comprehensive evaluation, whether the person, I find out, their whole medical history, whether they have had any kind of, surgeries in that location, in that area, if they've ever, experienced all of the things that they're experiencing, all of the signs and symptoms. I want to document that because over time, what I want to see is that those signs and symptoms start to decrease and we start to make progress with, more lubrication, more sensitivity, etc.
So if we're using it, now I'm so interested in this. If we're using it as a preventative and I don't have any of those signs or symptoms, how do we judge that?
So it's harder for a woman, right? Because for men, some of the signs and symptoms are really obvious. Like they'll stop getting morning wood, right? But they can still have sex, but they just won't get that. Or they won't have as many spontaneous erections throughout the day and night, which sometimes people don't even pay attention to. But, as a teenager, a man is having erections every half an hour, which is normal blood flow. But as we get older, that decreases. For women, it's so much harder to sort of pinpoint because our issues are so much more subtle. So it would be, over time, are you needing more lubrication to have sex? Are you feeling like you don't have as much sensation as you were feeling before? So and then of course, are you having painful sex? Because sometimes that is a big sign that there's something going on. So for women, it's a little bit more subtle, but if you're in touch with your body, you can feel all of those subtle issues. And so bringing them up to your doctor is important because a lot of times people, maybe don't put as much importance on it or they're embarrassed to bring it up. And so they don't want to talk to anybody about it. And they kind of wait until it becomes a severe issue. And that's really when it's harder to treat. When it's first starting or even in the moderate phase, it's much easier to treat than it is if you get all the way to the severe, aspect of the disease.
Sure. And so we've done our initial, it's about 45 minutes. We've done our intake. And do you come weekly? Is it daily? How does that work?
So I recommend once a week, ideally for the ideal client, okay, because, life gets in the way, etc. But really, once you start treatment, if you can, dedicate one day a week to coming to see me, you will be there for about an hour, maybe sometimes less. And it's once a week until your treatment is over. So if you're coming for prevention, it will be once a week for 6 weeks or more, depending on what we decide your treatment protocol is going to be.
Wonderful. I love this. I am just impressed. I'm impressed. I'm speechless at the technology that we're coming up with. And I'm also very frustrated that it's not common knowledge.
I 100% agree. I should have, people lining up and, a waiting list for all of the people that I can be helping, and I would love that to be the case because, when I do have clients that are seeing me for these conditions, it makes such an incredible difference in their lives that, it's night and day. And we all need to be taking care of our health in this way.
Absolutely. So, my next question was, what are the research developments or breakthroughs? But you've got it. You've got the breakthrough right there. That acoustic wave therapy, correct?
Correct. Yes. And that is really the gold standard for treatment of this condition and of erectile dysfunction. And it's interesting because that treatment has been around for many years and it's been used for many different things. It was actually used to break up kidney stones. Okay, that's what it was initially developed for. And they found that it also broke up plaque in the arteries, and it's also used, and I'm a physical therapist, it's also used for conditions of like the joints. For instance, if you had a knee surgery and you need to decrease inflammation, you would use it for that. You would use it. It's a healing modality. So it's not just for penises and vulvas. it's also for treating other musculoskeletal issues as well.
I know. I'm when I get off of here, I'm researching all of this because again, I saw that was what you were talking about on SDC a couple of weeks ago at one of your webinars, and that just caught my eye. And I was trying to find a subtle way to bring it up, but you just brought it up for me. So
Yeah. Yes, and I love talking to my SDC friends, and I have a group on there called the Please Me Health Collective, and I do free webinars, as do you. And I love getting clients from SDC because these are people that are really dedicated to having incredible sex lives. And these are the people who want to make sure that their function is going to stay amazing. So, it's a great clientele to have because they really care about that part of their life and about that part of their health.
And for those of you who do not know what SDC is, SDC.com, is a website for people to educate themselves about alternative lifestyles, meet people in the same lifestyle, the same kind of genders, maybe preferences, desires, whatever. It's a dating website for adults who are in relationships or maybe just wanting to expand, just wanting to learn more. So when you hear us talk about this, don't think that it's some scary website. Like it's an educational base. There's lots of really great articles on there, really great educators and practitioners who want to help. But also you can learn a little bit more about you and your sexuality. So just a shout out to SDC.
Yes, absolutely.
Pelvic floor therapy. How is that different than maybe the acoustic wave therapy?
So pelvic floor therapy it can be used in conjunction with acoustic wave therapy, or it can just be separate. So a lot of times I'll treat women who have the most common issue is incontinence. And incontinence is such a common condition. I mean, women in their 20s that are, athletes experience incontinence. I think it's 40 to 45% of athletes in their 20s experience incontinence when they're playing their chosen, sport. So it's a super, super common condition. And over time, it also becomes worse and worse, And so after you've had children, it can, become worse. Also, as hormone levels decrease, it can become worse. And so that is a condition that I treat in my practice a lot. And it relies on the pelvic floor or the muscles of that part of your body to be strong. And so if those muscles become weak, and, muscles do become weak over time if you don't use them. So if you don't use it, you lose it, right? And that is so true for the vagina and for all of the musculature of the pelvic floor. If you're not using it, you're going to lose that strength, and then you're going to start having issues. So strengthening the pelvic floor is important. But what I will say is that, a lot of times people will say, oh, well, just do Kegels, just do Kegels.
Exactly
right?
what I was to say.
Well, the pelvic floor, because it's all muscles and because the vagina is also all muscles, you don't want to strengthen something if it's in spasm. And if you're having painful sex, or if you're having tension in that area and you're holding stress in that area and your body is tense in that area, you need to focus on decreasing the tension first before you do any kind of strengthening exercises. So it really does require a comprehensive physical therapy evaluation where somebody does an internal exam to really touch and feel all of the muscles that are involved in your pelvic floor to see if there's any areas that need to be calmed first before you start doing strengthening exercises. So if the Kegels aren't working for you, it's probably because you need more than just that.
Okay. And again, is that a type of therapy that they need to come see you for regularly, or is it something that you teach them to do at home? Like they come and,
Yes.
Yeah,
yes. Because when, every single first visit of a physical therapy, wherever you go, you're going to get an evaluation. And the therapist is going to evaluate you for your particular body and your particular issue. So we're going to touch on all of those muscles, see which ones are weak. We will be making notes of what sorts of things we're finding. Do you have decreased endurance? Do you have decreased fast twitch? Do you have decreased slow twitch? Can you hold a contraction for a certain amount of time, or does it sort of peter out? So we're paying attention to all of those things because what we want to see is that over time through treatment and through education, exercises, lifestyle changes, that your body is going to start to change, and it's going to start to change in the direction that we're trying to help you, to become better. So yes, so we will be seeing you. I would be seeing you once a week for pelvic floor therapy as well.
Let's just remind everyone that this is Evolve Your Intimacy, and I am Dr. Stephanie from Evolve Your Intimacy. We are having an amazing discussion, but we need to take a quick break, so stay right there and we'll be right back. Are you a clinician or coach looking to deepen your understanding of diverse relationship dynamics? Dive into the Clinician's Guide to Ethical Non-Monogamous Relationships, working with clients with alternative lifestyles, the essential resource for navigating the complexities of modern relationships. Explore evidence-based approaches and gain invaluable insights to support your clients in ethical non-monogamous partnerships. This guide is your key to fostering empathy, understanding, and inclusivity in your practice. Don't miss out on this groundbreaking book tailored for the progressive clinician. Unlock the potential to revolutionize your approach and empower your clients. Visit evolveyourintimacy.com today to secure your copy and take the first steps towards evolving your practice. Evolveyourintimacy.com, transforming the way we understand love and relationships. Don't wait. Order today. Your practice depends on it. Ladies, are you ready to take your intimacy to the next level? And gentlemen, do you want to add more tools to your sexual repertoire? Head over to our website, evolveyourintimacy.com, to learn more about intimacy, relationships, and sex counseling. And if you enjoy our content and our guests, we would love to have you help us grow. Go to our website, evolveyourintimacy.com, to follow, like, and subscribe to all of our social media accounts. Now, let's get back to the show.
So, question. Pelvic floor therapy, acoustic wave, and menopause. How does all that play together?
So a patient might come to me with, let's say that the person has painful sex, right? And they're not able to insert the penis in because it's too painful. So there's treatments that can be done for that particular condition. I'm going to be looking at, like you said, making sure that the patient has a current hormone panel, if not sending them off to the doctor to do that. In the meantime, we're going to be talking about what they can do to increase their hormone levels, and I give them recommendations for that. There's a company that I recommend called Parlor Games. It's a topical hormone replacement therapy that I use myself, and that has made my incontinence disappear. So I talk to them about that. I will talk to them about how they can increase their blood flow with acoustic wave therapy. Also, painful sex, a lot of times it's caused because of, like I said, those chain link fences, right? The hormones that aren't in place. So once the hormones get strong, or the hormones increase and the tissue gets stronger, then we're able to do more treatment like the acoustic wave therapy, etc. So it might play into the whole of the treatment protocol depending on the person. And, I can't really say for sure, but it could definitely, all of those things could kind of come together. And a lot of times women that are in menopause or perimenopause or postmenopause will have decreased blood flow. So we want to increase that blood flow with the acoustic wave therapy.
I love that. As I am in perimenopause, and it is,
too.
I haven't got fully into it yet. I feel like I'm into it. These hot flashes are just killing me. But, there are things that are happening to my own body that I'm like, And as we're talking, I'm like, so maybe I need to come see you because, it is one of those things where I want to maintain optimal sexual health, because not only am I an advocate for the lifestyle, not only am I an expert, I guess you could call me, in lifestyle relationships, that's my specialty, but I'm also in the lifestyle. And so I like that element of it as well. And to have that not taken, but kind of the pleasure decreased because of me going into perimenopause, I might I think that I might need some of that therapy you're talking about.
And I would be happy to help you.
Where are you located?
I am in Palm Beach County and I have a practice there. And I also can do virtual visits. It would not be obviously hands-on acoustic wave therapy, but I do offer a very comprehensive protocol. So if you're integrating those other things that I recommend into your life, you are going to have benefits as well. But if you want to get the acoustic wave therapy and you don't live near me, you can, reach out to, oftentimes urologists' office have it. The payment is going to be extremely high. It's usually out of pocket if you're going to like a urologist or something, but there are practices that have it around the country.
I love that. Okay, I'm going to do some research on that.
Mm-hmm.
Now, how do psychological factors contribute to vaginal dryness and decreased sensitivity? And what roles do you think that mental health therapy plays in that treatment?
Well, I mean, it's so huge because, for women, you have to be turned on in order to get wet, And, that's not to say that sometimes that can happen when you're not turned on because, in certain situations where you've heard like in rape situations or in, that your body responds as it's supposed to when you're in a situation that's maybe not the happiest or the what you're consenting to, right? But for the most part, okay, when a woman gets turned on and, our biggest sexual organ is our brain, right? So you have to be turned on. When your brain is turned on, it sends signals to your genitals to lubricate, to engorge, blood flows there, and things start to, tingle and get sensitive, right? And if you don't have that connection, that mind to genital connection, you may not have the normal sexual response that you need.
And being a mental health counselor,
Yes.
it is vital that if you are feeling something, depression, anxiety, and I hate to be this blunt about it, but even if you're not having the sex you want to have and you're not saying that to your partner and you're internalizing that, that's mental anguish because every time you have to have sex, you feel like you're taking one for the team. You have to do it. And that wears on you mentally. So opening up those conversations about even are you having the sex that you want to have? What does that look like is very powerful as well. And
Communication is everything in relationships. And if you're not having those conversations, more likely than not, you are not getting your needs met. And so, I love to say that the kink community and the LGBTQ community does it way better than the heterosexual community, right? Because they're constantly having conversations about what they want to consent to. What's an absolute yes? What's an absolute no? What are the soft limits? Who's going to be the dominant person? Who's going to be the submissive person? Who likes this? Who doesn't like that? I mean, if you are having these conversations, you are going to get your needs met way more than if you're just assuming that your partner, just because they're the opposite sex, is going to know what to do. And that is not enough.
It is not. It is not. And I would scream that from the rooftops because now you want to have the sex you want to have. And whatever it is, it's okay as long as everybody's consenting and I'm not going to yuck anybody's yum. Enjoy it. But talk to somebody if you're not. Don't sit there and live in an unhealthy sex marriage relationship. Maybe it's sexless at this point because it's just not worth it to you when you can be having the best sex of your life, no matter how old you are. And I get to travel all over the world and teach all my fun classes. And my favorite classes to teach are the classes where my older adults come in, and it's called Sex Reimagined. And so usually my demographic is anywhere from 70 to 85. And
I love that so much.
They're having the best sex they've ever had. And they just, want some different tweaks and different activity or, just some ideas. And I've had my one little gentleman, he was 85 years old. He came to my class, Sex Reimagined, him and his partner. And he was literally mad that him and his wife were not having sex 4 times a week anymore. And he was like, we used to, and now we're not. And she's just like, things change down there. I'm 84, he's 85. And So we learned some new positions. I listened to them. We learned some new things, some new techniques. And after the trip, I get an email. And this man, he said, I've never sent an email before. I had to show my daughter had to show me how to set this up. He goes, but you had to know that we're awesome. Best sex of our lives. And he goes, thank you for that. And so I have that email saved. But
that needs to be like on your wall, you know?
I was just thinking, so did your daughter, like, how did you explain that to her? And so as we begin to wrap up, what can we do better to educate and support women dealing with decreased vaginal sensitivity and dryness?
You know, just having this conversation is what people need to hear. I mean, this podcast right here needs to be broadcast everywhere, you know, and shared with everybody that you know, because it's so key for people to understand that, you know, the issues that they're having can be solved and there is a solution to the problem. So I think just education, and that is just so empowering.
Exposure to the knowledge.
Absolutely.
The word, you know, normalizing vaginal sensitivity, normalizing the word vagina. Come on.
Normalizing vulva, normalizing clitoris.
Yeah.
You know, a lot of times people think that the clitoris is just that little nub, right, on the outside, but it is a huge organ. It is almost the size of a penis. This is a small model of a clitoris. It is not small, okay? Women, you guys have big clits, right? I love to talk about big clit energy, you know, because that is really the confidence that we have in our sexuality in order to have those conversations. And that confidence really translates to all areas of our lives. So I love talking about, you know, getting that big clit energy for yourself, whatever that may be for you. And so I always hope that all of the people listening do find that for themselves.
I do too. And so tell everybody how they can find you, and if they want to work with you, how they can contact you.
Absolutely. You can find me on pleaseme.online. That is my website. It is my website for pretty much everything. You can contact me there. On my contacts page, all of my socials are listed there, so you can click on all of those and follow me. I also have a podcast, like I mentioned before, called Please Me. You can see it there. You can also watch it on YouTube. And, you know, reach out to me and make an appointment. I'm here to help you.
Absolutely. And you can find all of her information in the show notes. And I absolutely want to encourage everybody listening, share this podcast with your girlfriends, share it with your sisters, share it with your mom, share it with everybody, because we need to normalize that your vaginal dryness and sensitivity is okay. And there's a cure, just like with erectile disappointment, dysfunction, whatever we want to call it. There is no. I don't call it dysfunction. I call it erectile disappointment.
If it's disappointment, you know, it is. That's when you said that, because when it occurs, it's like, well, you know, like, this is no fun, you know. You want your partner to have a nice hard penis, right? So if that's you and you're listening and you might be having, you know, decreased sensitivity, but your partner might also be getting soft too soon, or you're not able to put it in, make sure that you share it with him too, because this treatment is good for him as well.
Absolutely. Well, thank you for taking some time to educate us. And I look forward to working with you again in the future.
Me too. Definitely. It was a lovely experience.
Thank you for taking time out of your busy day to listen to my show. I am Dr. Stephanie with Evolve Your Intimacy, and remember, you are not in this alone, and we are definitely here to help. You can learn more about all the amazing things that we do at evolveyourintimacy.com, and if you subscribe to our newsletter, you will receive free resources monthly to help you evolve your intimacy. Thank you again, and have a great night.